Did you know that coccidiosis, a disease caused by microscopic parasites, contributes to a staggering loss of over $3 billion annually in the poultry industry alone? This illness, caused by the protozoan parasite Eimeria, mainly infects the intestinal cells, leading to severe health complications in animals. The global impact of coccidiosis, especially in poultry farming, is immense. The economic implications are far-reaching, affecting not just the farming industry, but also the global food supply chain. This is a clear demonstration of the devastating effects of coccidiosis. So what exactly causes coccidiosis? Well, it's caused by protozoan parasites of the Eimeria genus. Now, these aren't your everyday garden pests. These are microscopic invaders that primarily target the cells lining the intestine of their host. Let's delve a bit deeper. Imagine this parasite as an unwelcome guest that settles into the host's intestinal cells. Once settled, it starts to multiply. In an act of biological betrayal, the host cell becomes a breeding ground for these parasites. This multiplication process, or replication, is what escalates the infection. But it doesn't stop there. As the parasites increase in number, they cause significant damage to the host's intestinal cells. This damage is the result of the parasites breaking out of the cells in which they've been multiplying. Imagine a crowd exiting a stadium after a game, but in a much more destructive manner. The parasites leave behind a trail of ruined cells, which disrupts the normal functioning of the host's intestine. This disruption can lead to a range of health issues for the host, from the mild to the severe, depending on the extent of the infection and the host's overall health. The more parasites, the more severe the damage, and the worse the resulting health issues. So the root cause of coccidiosis is an infection by these microscopic parasites, leading to significant damage in the host. How can we tell if an animal has coccidiosis? There are several symptoms to look out for. As we delve deeper into the symptoms of coccidiosis, it's important to remember that these can vary based on the animal species infected, the parasite strain, and the severity of the infection. One of the most common symptoms is diarrhea, which can sometimes be bloody. Affected animals may also show a loss of appetite, leading to noticeable weight loss. Dehydration can occur as a result of the diarrhea, further weakening the animal. Particularly in young animals, a delay in growth can be observed. This is due to the fact that the disease affects the intestinal cells, hindering nutrient absorption needed for healthy development. Lethargy and weakness are also common symptoms, as the disease takes a toll on the animal's overall energy levels. In severe cases, coccidiosis can even lead to death. These symptoms are a clear indicator of an animal possibly suffering from coccidiosis. Diagnosing coccidiosis involves both clinical signs and laboratory tests. This vital step in the fight against coccidiosis is often based on characteristic clinical signs. These may range from diarrhea, sometimes bloody, to loss of appetite, weight loss, dehydration, slowed growth in young animals, weakness, lethargy, and, in severe cases, death. However, these symptoms alone are not enough to confirm coccidiosis. The disease shares symptoms with other illnesses, making it a bit of a tricky puzzle. So, to definitively diagnose coccidiosis, laboratory examinations come into play. One common method is the microscopic examination of stool samples to detect the presence of the parasite. Blood tests can also be employed to assess the damage to the intestinal lining, another telltale sign of coccidiosis. Combining these different diagnostic tools provides a more accurate picture, allowing for the most effective treatment plan. Diagnosis, therefore, requires a combination of clinical signs observation and laboratory tests. Interestingly, there are many strains of Eimeria, each infecting different animal species. This means the types of coccidiosis that an animal can contract vary greatly based on the host. It's a fascinating, albeit concerning, aspect of this disease. Let's take a look at some examples. Avian coccidiosis, for instance, affects birds. This can have a huge impact on poultry farms, where an outbreak could lead to significant losses. Then there's bovine coccidiosis, which primarily infects cattle. This can cause serious issues in dairy and beef farms. We also have caprine coccidiosis, a strain that targets goats. Each of these types presents its own unique challenges for diagnosis and treatment. They each have their own cycle of multiplication and invasion, and they can cause damage to different areas of the intestinal tract. As such, Coccidiosis is not a one-size-fits-all disease, with different strains causing different types. Now that we know what coccidiosis is, how do we fight it? The battle against coccidiosis is waged on several fronts. Prevention and control revolve around 5 key strategies: maintaining hygiene, controlling overcrowding, administering medication, applying vaccinations, and ensuring proper nutrition. Hygiene is the first line of defense. By maintaining sanitary conditions in the animal's environment, including regular cleaning of enclosures, we can limit the opportunities for the Eimeria parasites to multiply and spread. This is crucial because these parasites thrive in unsanitary conditions, laying their eggs in the feces of infected animals. The second strategy is controlling overcrowding. Overcrowded conditions can accelerate the spread of coccidiosis, as the close proximity of animals allows the parasites to pass easily from one host to another. By giving animals ample space, we can help to limit the speed and extent of an outbreak. The use of anticoccidial medication is another critical tool in the fight against coccidiosis. Administering these drugs to infected animals can help to control the disease and limit its spread. However, it's important to note that medication should be used judiciously to avoid the development of drug-resistant strains of the parasite. Vaccination offers another layer of protection. In some cases, it's possible to vaccinate animals against specific strains of Eimeria. Vaccination can help to boost the animal's immune system, enabling it to better fend off an infection. Lastly, proper nutrition plays a pivotal role in the fight against coccidiosis. By ensuring that animals receive a balanced diet, we can strengthen their immune systems, making them less susceptible to infection and better equipped to recover if they do contract the disease. Remember, each of these strategies is important on its own, but when combined, they provide a comprehensive approach to preventing and controlling coccidiosis. Prevention is key in reducing the prevalence of coccidiosis, especially in farming operations and breeding facilities, where it can cause significant economic losses. By integrating these strategies into animal care practices, we can help to protect animals from this harmful disease and ensure their health and productivity. So, to recap our discussion on coccidiosis, this disease, caused by the protozoan parasite Eimeria, primarily infects the intestinal cells, causing extensive damage. Symptoms range from diarrhea, appetite loss, and dehydration to stunted growth in young animals. Diagnosis often involves lab tests, such as stool examination and blood tests. Various strains of Eimeria affect different animal species, thus resulting in different types of coccidiosis. However, with proper hygiene, population control, medication, vaccination, and nutritional management, we can reduce the impact of coccidiosis and ensure healthier animals and more productive farming operations.